How are donors selected for an allo transplant?
So donors are picked sort of depending on the kind of transplant you're doing. So there is some matching that goes on, right? You come from your mom, so my guess is that there's 100% chance that you're at least half matched. So if they're considering doing a haploidentical transplant, you would be eligible as a donor, right? Would it be you versus one of your 5 siblings? I think it depends on, there are sort of more nitpicky things about it. What viruses have you been exposed to? Are you male or female? Sometimes male donors maybe have less graft versus host disease produced. What other medical problems do you have? So there's a whole host of things. And a lot of times there are just, many donors for a patient. And it's kind of like, I let them choose. Which one of you want to do it? Because to me, it's not like one is better than another medically, but who wants to do it? Some people say, look, I want to be the person to do it. Other people say, oh my God, I don't really want to do it, but I'll do it. And so I think that those things now start to come into play.
What age of immune system do you want for an allo transplant?
So the donor selection is, again, a moving field. Many years ago, when we were not so good at picking donors or looking at the matches, we used to always go for a sibling that was matched to the patient themselves. But most of your siblings are going to be around your own age. So if you are a 70-year-old person with multiple myeloma, your siblings are probably going to be between 60 and 75. So your siblings are older. And then over time, the way we select donors became more and more sophisticated. And we have large donor registries which have more than 15 million people worldwide who are who are volunteers who have signed up to be donors. So it turned out that we could actually select unrelated people who are HLA matched to you. HLA is a system of genes in your body which are immune responsive genes that predict who can be a donor to who in terms of bone marrow transplantation. So it's called the HLA system. So we do something called HLA matching to select a donor. So these days you can select an HLA matched donor who's not related to you, who might be in another country, for example, but at a young age, or most of these donors in the big registries are between the ages of 20 and 45. So if you're a 70-year-old person and you get a younger unrelated donor, the risk from transplant is generally these days unrelated transplants and sibling transplants are the same risk, but you get a better, younger immune system.